We're really here today to talk about how and why how and why public policy matters for survivors of domestic abuse and violence, and also to explore how it is that Mainers can engage in meaningful ways in that process. We are interested in public policy broadly. So I think a lot of times when people hear public policy, they think immediately about legislation, they think immediately about laws, but we're also considering the processes of implementation that follow the making of laws as really having a significant impact on folks' lives. And so we also want to help people think about that process, which is often, I think, kind of invisible to the public eye. The last thing I would say is that we're looking at public policy and the ideas of safety through a wide lens here. We at MCEDV really believe that we have to look at all of the domains of our lives in order to find how we can best lift up and support survivors. It's important that we think about safety in broad ways and not only as about physical safety in the moment of crisis, though that is certainly very, very important. We have to widen that lens. And so that's a lot of what we're going to be talking about today is how do we widen that lens and what other things should we be thinking about when we think about public policy that impacts survivors of abuse that we might not traditionally have been thinking about in our minds. So without further delay, I want to introduce our panelists. We'll start with Kathy Kilrain Del Rio. Kathy is the Director of Campaigns and Healthcare Advocacy at Maine Equal Justice. Kathy, do you want to speak for just a few minutes about what you all do at MEAJ and what your work is there?
Yeah, it's my pleasure. Thank you, everyone. And just on a personal note, like so many of us, I am in a house with a young child. So if you hear strange noises or my video goes off for a minute, it's probably because of that. So just a caveat. But thank you. I'm so happy to be here today. And for those of you who aren't familiar with Maine Equal Justice, we're a nonprofit civil legal aid and economic justice organization. And we work to try to increase economic security, opportunity, and equity for people here in Maine. And we do that in a bunch of different ways. First, we have a direct service aspect to our work. So we have a hotline and a legal services team that will take people's calls about pretty much all of the safety net programs. So if you need help with food assistance, SNAP, with Medicaid, Maine Care, if you need help with certain types of housing issues, unemployment insurance, especially now with COVID and all the complications that that has added, all those different types of benefit programs, general assistance, TANF, we work directly with people to help them figure out like what are their options, what are they eligible for, and also if they run into problems, particularly with the Department of Health and Human Services or the Department of Labor, depending on the program, we can help them with appeals or help talk with the department. I'm also going to just note, I think I hear some background noise, and if folks can make sure you're on mute, that would be helpful. Thank you. Related to that, we also have a litigation arm. So we have, when I say arm, we have 2 lawyers on our staff who help with direct litigation for people in the case of like needing to do something with the Department of Health and Human Services or the Department of Labor, or with the municipality in some cases. Probably the most famous example for us of our litigation is the implementation of Medicaid expansion. Many of you might remember that we had an election back in 2017, 2017, where we voted for Medicaid expansion, and then Governor LePage didn't want to implement it, and so we sued the state to force them to implement that policy. So it can be for an individual or it can be for a class of individuals, multiple people who are affected. And then we do a lot of public policy, both at the federal, state, some municipal level work, and administrative advocacy, which is related to that implementation piece that Regina was talking about. And we do that across a lot of areas: healthcare, income supports, food security, consumer rights, housing, unemployment insurance. And a really crucial part of our work is our organizing team. They work directly with people who are currently experiencing poverty or have experienced it, people with low incomes, to help figure out like what are the best solutions to the problems that they're facing, because we believe that people with low incomes are the best experts on those solutions, and we believe their experiences, and so we want their leadership and their experience to help guide our work. And as part of that work, we have a group called the Equal Justice Partner Circle, which are people who have that lived experience, who help weigh in on our policy priorities. They help guide the policy team into how we should spend our time and what we should prioritize. And then they also learn a lot about the advocacy process and how they can help advocate for the policies that they care most about. And then I guess finally, I just say we also have communications as a big part of our work. We have a website, MaineEqualJustice.org, where you can find a lot of information about the various policies that we work on, as well as there's a place there where you can ask for help from our legal services team. And then we do a lot on social media, particularly Facebook, Twitter, and Instagram. We'll talk more about the specific policy areas as we go through today, but I'm so happy to be here. Thank you.
Thank you, Kathy. That was fabulous. Really appreciate it. Now I want to turn it over to Maya Williams. This is the first time we're actually meeting after many emails, so thank you so much for being here. Do you want to spend a few minutes telling people about the work that you do at Maine Transnet and what your mission is?
Yeah, absolutely. Hi, everybody. I'm Maya. I go by they, them, and she, her pronouns alternately. And Maine Transnet is a statewide nonprofit that works to advocate for trans people. And my job is specifically the sexual assault program coordinator. So I work particularly in sexual assault and domestic violence related programs. So that includes our support groups. Most of them are online right now. We will start an in-person one in Bangor next week, and we'll start an in-person one in Portland in January. And we also educate SA and DV advocates, as well as providing education to safe nurses on trans competency for survivors. And in order to know more information about our programs and our work and to receive training, you can go to mainetrans.net/survivors, and I can put that in the chat for folks. And I greatly appreciate being here. Thank you, Regina, for having all of us.
We're really grateful to you. Thanks. And then Desti, I know you've already given us the housekeeping, but you know so much more about what happens at Maine Women's Lobby than the privacy settings on this Zoom. So can you tell us a little bit about your work?
Sure. Hi, thank you so much for having me. I'm Desti Homan-Sprague. I'm with the Maine Women's Lobby. Maine Women's Lobby was founded in 1978 to support gender responsive and gender equitable public policy in Maine. It's really a fun origin story, actually, where a group of dedicated activist women wanted to see change in the State House. And it's related to this work because they got together and they decided that their first bill was going to be to support statewide funding for what was then called battered women's shelters in Maine. And they laid all the groundwork, they lobbied their legislators, and got it through committee, got it through the House and Senate. And then ultimately the bill died on the floor, or on the appropriations table, the funding table, in the last night. And they really found, that it was because they didn't have somebody at the table. There wasn't somebody in the room. And so they got together and started with $2 memberships. And the Women's Lobby was born to have somebody in the room who's really able to think about, talk about, focus on legislative advocacy and system change for gender equity in Maine. So, now fast forward 42 years, we're continuing to support gender equitable public policy. Our focus is on folks who are most affected by misogyny, sexism, and other forms of oppression. We focus our policy advocacy on freedom from violence, freedom from discrimination, access to healthcare, including the full range of reproductive health care and abortion, and economic security. We also advocate for systems and representation that ensure gender equity and justice. And that means systems and representation from the top level in terms of who's at the table making the decisions, and also representation in terms of who gets to cast a vote, who's able to access a ballot. Democracy access is really important for us. So we do that work through a range of not only legislative advocacy, but also community engagement and community organizing across the state. You can find out more about our work at mainewomen.org, and I will also put that in the chat. So, thanks, Regina.
Thanks, Desti. And then finally, I'm here with my colleague, Andrea Mancuso, who is the Public Policy Director at the Maine Coalition to End Domestic Violence. And MCEDV is really the statewide organization that supports the work of our network of member programs across the state. We have 8 domestic violence resource centers that together serve all of Maine's 16 counties. And our 9th member is the Immigrant Resource Center of Maine that provides culturally and linguistically specific services in new Mainer communities, particularly in Cumberland and Androscoggin counties. And so Andrea does a lot of our public policy work at the State House, and she will be here taking your questions, collecting them through the chat. So the way we're hoping to play this today is to avoid strange feedback issues, is to keep everyone on mute for the first section at least. If you have questions that come up during the conversation, send them through in the chat, and then Andrea is going to sort of compile those, synthesize them if people have a similar theme. And then after we move through our set of questions, then we're going to move out to you all's questions. All right. Okay, so let's get rolling. The first question that I have is for Kathy. We know that economic abuse is an extremely common tactic used by abusive people in Maine and everywhere. That can look like controlling finances, interfering with employment, ruining people's credit. And those kinds of tactics are employed by abusive people within a sort of social and economic and political context that often throws up additional barriers for people who are trying to achieve long-term financial stability. So given the experience that you've talked about having with Maine Equal Justice, can you please describe for us what was left undone in the last legislature regarding economic justice? And then what should we be looking for when the legislature convenes again?
Yeah, thank you for that question. It's a good one. I started to put together a list of bills that were left undone when the legislature adjourned in March, and when we thought at the time that they were going to come back in for a special session in the summer, which they didn't do. So I started to do that and then realized it's a really big list from our perspective and probably a little overwhelming for you if you're not into memorizing bill numbers and titles. So I thought I'd instead talk a little bit about sort of some buckets of work that were left undone and that I think in many cases will come back next session. And they may look a little different too. And I'll talk a little bit about that as well. So one area that I'll start with is healthcare. Obviously, for people who are struggling with economic security, having access to affordable healthcare is critical. It's critical because we all need access to healthcare, but also because we know that like a significant place that can harm people's budgets and their stability is medical debt. And people avoid care when they're afraid that they can't pay for it, needed care. So there are several bills that are near and dear to my heart that were left on the table. One was a bill that would have created a adult dental benefit in the Medicaid program. Right now here in Maine, we only really provide coverage for people who are on Maine care if they're an adult for dental care, if it's an emergency or if it's something that's like directly affecting their other healthcare needs in a way that like the state decides it's cheaper to fix the problem in their mouths than to have to deal with the long-term consequences of inaction, which is really not a great way to decide how to do your healthcare. And we had a bill, we actually had 2 bills in the last 2 years that would create this benefit. It passed through the legislature with unanimous support, had unanimous support in committee, and was on the table in appropriations when the legislature adjourned. I know for sure that that bill is coming back again this year. And I think that's also a critical one because we know that oral health care affects lots of other aspects of our lives. When you have issues in your mouth, it can sometimes affect your self-esteem and your mental health because you're afraid to smile, you're afraid to open your mouth and talk, and even just to be seen. Obviously, that has a huge effect on people's well-being in multiple ways. It also affects people's employability, especially if you are trying to look for work in any kind of public-facing position. And then also, it does affect people's overall health care. We know for sure that poor oral health can impact things like heart disease and diabetes, amongst other issues. And so this is something we really do need to get under control here in Maine. And another healthcare issue that was left on the table was a bill that would have expanded access to a program called CHIP, which provides health insurance for low-income children. It's also part of our overall Maine Care program here in Maine. That bill would have expanded access and just made it easier for people to get on CHIP without a waiting period in certain circumstances, and would have made some other things about it, just less barriers to access, which is so important when we're trying to get our kids health care. That bill was left undone. There were also bills around consumer rights. So, for example, a bill that would have helped amend an existing statute, an existing law, that would deal with how debt collectors deal with medical debt, for example, and some other things around debt collection practices. Again, when you're dealing with economic security, there's lots of ways that debt collection and debt in general can really harm people's long-term ability to build savings and to get out of poverty and into a more secure place. So it would have had several amendments that would have helped support that. There's also there were several bills that were around housing, particularly around foreclosures and dealing with how banks deal with people. And then also access to things like childcare, which again is critically important for all people who are working parents or trying to go to school as parents. You need to have some place for your kids to be safe and healthy. And childcare here in Maine is a huge issue. So there were several bills that would have expanded access to good childcare programs. So those are some examples of like what was left undone. And I also just wanted to say there were a bunch of reports coming from different task force or working groups that got created in the first year of the legislative session, so back in 2019, that would have made recommendations to committees to put new legislation out, things related to TANF Aspire, which helps low-income parents, things related to childcare, things related to general assistance, things related to SNAP. And a lot of those reports were coming out right around the time that the legislature adjourned. So those reports never even really got considered by their committees, or if they got considered, like any resulting legislation hadn't yet been reported out from their committees. So like all of that work that was done by task force and working groups, often with impacted people as part of the process, kind of got stuck in limbo when the legislature adjourned. And the last thing I just would like to say is that with COVID, we also saw more issues. Many of us already knew that those issues existed, but it really shined a light on access issues and equity issues, particularly disparities for Black, Indigenous, Latinx, other people of color in our state. And I think there was definitely a lot of work, we could talk more about this today, that was looking at like how can we think about equity and think about ending disparities based on race or ethnicity or other disparities that exist for other populations as we do legislation. And I think there'll be bills that will look at that directly when we come back in next year.
Thanks, Kathy. That was really helpful. I was just thinking as you talked about all the connections that I saw, I was thinking of to survivors' lives, like how common we know it is for folks to have sometimes injuries to their mouths that need dental care, how important that can be, how important the childcare piece is for survivors who are trying to perhaps separate from an abusive partner. That is often named as a pretty big barrier. And also really thinking about the pieces around debt collection and what we learned in the economic abuse study that we did of survivors in Maine a few years back, and how ruining folks' credit and racking up debt in their name is a pretty common tactic of abusive people in Maine. So seeing a lot of connections there for sure. Thank you. Maya, this question is for you. The research tells us that trans people experience abuse and violence from partners at disproportionately high rates, and yet their experiences are frequently overlooked by the public at large who is seeking to address these issues. So in 2015, the United States Transgender Survey revealed that 54% of the respondents had experienced some form of intimate partner violence. Can you talk about the cultural context within which trans people experience partner abuse and identify some of the policy issues facing trans people here in Maine?
Thank you so much for that question. And I also think that it's important to note that of that percentage who experience sexual violence, 64% attempt suicide after experiencing that violence. So we can see how much harm sexual violence and domestic violence does to trans people, and it's very important to note. And when it comes to the policies for trans people, particularly in Maine, I'm really glad that Kathy brought up economic justice, because even though there was a policy passed that tends to be more inclusive for insurance for trans people in trans care, that's great, that's wonderful. And we have a lot of trans folks in our community with low income that use Maine Care, and even though we have trans competent medical providers who take Maine Care, that doesn't mean that there are surgeons who do trans care that take Maine Care. So there needs to be a policy that is able to raise the reimbursement level when it comes to Maine Care when we're talking about economic justice for trans people. And more so when it comes to youth as well, because a lot of youth struggle with violence at home and struggle with violence at school. When it comes to intimate partner violence, 25% of trans youth experience intimate partner violence compared to 8% of cisgender youth. That's a very wide gap there, right? And when we talk about economic justice, again, when there is that risk of being exposed to violence or experiencing violence, there's more likely to face job insecurity and other financial insecurity. So when it comes to school policies, being able to make that more expansive, when it comes to teachers being more LGBTQ plus inclusive, teaching LGBTQ plus history and teaching LGBTQ plus sex education, and sex education in a way that teaches not only about like, here is what you need to be aware of when it comes to violence in communities, but also how to have joy and how to have pleasure in relationships, because it's not fair to tell trans youth immediately as they're growing up that things are going to be hard for them and that they deserve it, because trans youth do not deserve harm. They deserve all the love that other people get to enjoy. So it's important to be particular about that when it comes to policy and talking about the research and how that reflects the people we engage with every day.
Thanks for that, Maya. And I'm thinking about the opportunities as we move into this next question. I'm going to ask Desti about how Mainers can engage. But as I listen to you, I'm thinking about the opportunities that exist at the local level too, to be influencing what your schools are doing, how schools are bringing in some of that content, for sure. Desti, so part of what you all do at the Women's Lobby is to help empower Mainers with information that allows them to engage in meaningful ways in the policy process. So generally speaking, what do you think are some of the barriers that can keep people from connecting engagement with public policy, which might not be a very exciting set of words for some people, right? With the issues that they really care about, domestic abuse and violence being one of those issues, but if you want to speak to that broadly.
Sure, I'm happy to. I think that the barriers around, engaging in civic life and engaging in, because I think it really starts with civic life. Like, what does it mean to be part of a participatory democracy? And, how are the pathways that people can understand, like how our systems are informed, how our systems are built, and what their potential role might be? All of that has to happen before we even get to the part about policy change for the most part. But I think some of the barriers for why people don't engage are both intangible and then more tangible. So first, the intangible barriers are around, understanding the process. I think that there's actually lots of science to back up that if you are in families and communities where policy and systems and democracy and voting aren't part of the dialogue or sort of part of the water or part of the culture, then the whole process, I think, just feels less accessible. And then we know that there are tangible barriers put up for many communities to keep them from engaging in the process, from being decision makers, from being able to vote. For example, Black women on the whole wait far longer than any other demographic to be able to vote. And so there are the tangible barriers around the access, but also that intangible, where if you're not watching people engage, if you're not watching people vote, then it feels very far away. It feels very far away from your life. And it's hard to understand how it might apply. I'll use actually my brother as an example. My brother and I grew up in the same family, and my parents voted religiously, and I vote religiously. But my brother has had a really different life path, struggled with substance use, been incarcerated. And when we talk about voting, for him, nothing about democracy feels relevant in his life. And so we sort of talk about the ways that systems have impacted him, and that he's engaged in the system, but it just feels like something happening on another planet. So it's kind of a rambly way of saying, I think that we need to be really real about the fact that for lots of communities, especially in communities that are most harmed and most disenfranchised from systems, from democracy, from sort of the levers of power, those are the folks who, in many cases, feel the system is less transparent for them. And that's in some cases by design, but like when it's not transparent, how will they know? If you didn't know that you kind of needed to request your absentee ballot by now in order to get it 2 weeks, to get it to your house and then back 2 weeks ahead of the election, you don't know what you don't know. So again, lots of that the language used feels not real and relevant for regular Mainers, that the systems used are hard to understand and access. If somebody really wanted to understand a bill and they went to the Maine legislature website, I've been working with the legislative process for 12 years in Maine, and I still sometimes struggle to find the information I'm looking for there. So again, just like lots of real barriers where if you even make it past the intangibles, the specific tangible things are just quite complicated. All to say, like part of the work that I see ahead of us at the Women's Lobby and with other organizations like ours is to try to translate out not only how policies and systems and civic life affect folks, because they know it, like they know that they're struggling to access childcare. They know that they're having to quit work because they can't, figure out a way to manage, healthcare needs or caregiving needs or et cetera. So they understand that it's part of their lives, but they don't always understand how to connect it to the policy change. And then when they do, they don't necessarily have the tools or resources to be able to do a lot about it. So our work is to help take the connections that they understand and translate that out to help them engage in the process, to smooth the barriers that the system has, thrown in front of them.
Thanks for that, Desti. And I saw a lot of nodding from our other panelists. So I just want to say, Maya and Kathy, Andrea, if y'all want to jump in with any thoughts about that or at any point along this, we don't have to do this like strict person to person to person thing. So.
Yeah, that just really resonated with me as well. I mean, I think one of the things that we often find in our work is someone will reach out to us because they're having a problem with a system that isn't working. And sometimes there is a solution that is easy and we can figure it out for them, and they just couldn't figure out the path to that solution because it's not transparent. But other times there really isn't a solution that will work for them because a law needs to change or a rule needs to change in order for that to happen. And then it can be very confusing. Like, does it need to happen at the state level, at the federal level? Does it maybe even the municipal level? Is it something that can be done through the legislative process, or is it something that should be done by a department? All of that is stuff that there's no way everyday people are going to know all of those pieces. And so a lot of our work for people who want to get involved in advocacy is helping them understand that process. So trying to help them with whatever direct need they need in the moment, and then helping them figure out, like, here's how the system is broken, and here's potential solutions that could fix it, and listening to them about what those might be, and trying to figure out, like, well, what path would get us to that solution? And it can be super complicated, even for organizations that are in the policy space sometimes, to figure out what that path might be, let alone for everyday people who aren't actually dealing with all these systems all the time, or at least they're dealing with the systems, but they're not dealing with the laws and rules behind them.
I would concur that sort of navigation, the system navigation, and then identifying the level where the problem occurs is some of the most important work of advocacy organizations who are trying to support citizens in achieving change. I'm sorry, Maya, I might have just run over you.
You are all good. I appreciate you. And I really resonated with what you were talking about when it comes to religion influencing voting, because when we talk about conversion therapy, and especially for trans youth, and blocking hormone suppressants for trans youth, it is an act of abuse. And even though there is a conversion therapy ban, it's kind of mute for religious leaders. And when we talk about trans homelessness and how inadequate housing resources are for trans folks, and how homelessness affects a disproportionate amount of trans folks, even though a lot of homeless shelters right now have to adhere to the Maine Human Rights Act, when it comes to serving trans folks, private homeless shelters and religious homeless shelters do not have to adhere to that, and how to advocate better for that, and making sure every trans person is housed adequately.
Thank you so much for talking about housing, Maya, because that's such a huge issue for survivors of domestic abuse generally as well. And it's one of the most murky systems out there in terms of navigating that. So thinking about what Desti and Kathy were saying too, about having to navigate that. So as we're thinking about these policy questions, like how should our housing system work, right? What you all are pulling out is really down the line, we in communities see that impact on the people in our lives and on ourselves, but we don't always connect it to here's how the system is set up. And that's what that's the role of policy, is addressing how that setup works. So thank you all for that.
Yeah, and Regina, if I could just add one other thing that actually relates back to the Women's Lobby's origin story. Like, the other piece that I think a lot of people don't always understand is like the intersection with finances for the state. Like, you can have a lot of support for something, and if you get it all the way through the process, you could have unanimous support for something, get it all the way through the process. If it gets to appropriations, which is what happens if it has any kind of fiscal note, which means if it has any cost to the state, then you still have to figure out how it's going to get funded and like get legislators to agree to fund it, both in the committee, but also beyond the committee. It's also about leadership in both the House and the Senate. It's about like the governor's office and whether or not they want to try to find money for something, and they'll support that piece of the budget or that appropriation for that bill. And that whole process and how appropriations for bills intersect sometimes with the budget process is super complicated and murky as well. And even a lot of advocates don't really know how that whole process works. Paid advocates, because there's lots of people advocates who are trying to figure it out as well. And the more we can shine a light on how that intersects with the process, I think the more we can understand like why something might have a lot of political support, but still can't get over the finish line. And I think especially that's important in times like these when, due to COVID, we know that there's going to be challenges in funding things next year. And in order to get a lot of things that we care about done, not everything has a fiscal note, we're going to have to find money. And that means like either finding money that already exists or passing additional bills that bring in more money for the state through revenue of some kind. So like, I think those are some other aspects of advocacy that people don't always think about when they're thinking about like, how am I going to get this thing? You can have a lot of support, but if you don't have the money to do it, it's still not going to happen.
Thank you so much, Kathy. So this next question is for any of you. So jump in if you want, and if you don't have an answer to this, that's okay too. But we've been talking some about how it's not only about what happens in the legislature, but it's about that sometimes a little bit murky process of passing rules and developing protocols and things. So can you, any of you, provide an example of how implementation of a law that was passed through that rulemaking process, et cetera, has had a significant difference on the impact of that law for the people in our communities?
I can share something. So a really good example, the states that passed marriage equality via referendum has the lowest rates of suicide, particularly for LGBTQ+ youth. So that in a way increases safety, having that cultural impact with so much news coverage. So that being super important. In the state of Maine, the trans panic defense is illegal. So if there is a domestic violence situation, the perpetrator cannot use the trans panic defense, which is like, oh, well, I hurt this person because I didn't know that they were trans, so I get to hurt them, right? And Maine law says, no, that's not how this works. So examples of that being public. And another thing, so when it comes to changing your name, and when it's shown in the newspaper publicly, that is a huge risk of outing someone. So what domestic violence survivors can do is fill out something to get that deferred so that their safety can be protected.
Oh, so this is something I'm learning right now, Maya. Are you talking about when someone's legally changing their name, and you're talking about them and there needing to be public notice of that? Yeah. And so there's this way within that rulemaking framework that was established for folks to have a safety consideration.
Yep, that exemption can be made if needed. Yep.
That's wonderful. Thank you. Kathy or Desti, did you have thoughts on this one?
Yeah, there's two that quickly came to mind. One is related to a bill that Maya was talking about earlier in terms of coverage for transgender services in Maine Care. So that was a great change that happened in 2019. And in the fall of 2019, the Department of Health and Human Services did rulemaking around that so that it could go into effect and be implemented. And the rulemaking process went pretty smoothly. I mean, there almost always can be ways to make the rules better. But in actual like implementation of it, because there aren't enough providers who accept Maine Care, who do certain types of services, partly because in the past they weren't covered. So that wasn't like a source of payment for those providers. But for lots of other reasons as well, because in some cases there's also just not a lot of providers who do certain services in the state of Maine who are safe. And So even though you technically have access to that service now, that healthcare need of yours, you may not actually be able to get it because there's no provider who accepts Maine Care. And that happens in other areas of Maine Care as well. It's not only around transgender services, but that's like a new one. And so like trying to highlight those deficits for the state so that they understand where there's gaps. And also like starting to think through like, how do we change that? Like, how do we recruit more providers? Like, what's the role of the state in that? How can other organizations help with that so that we do have a robust provider network who can provide those types of services for people? So that's like one example of how a pretty straightforward law change isn't actually so straightforward when it comes to actually like implementation of it. Another example that came to mind to me was a law that passed back in 2015 around general assistance for people who are lawfully present, for immigrants who are lawfully present here in Maine. It mostly impacted asylum seekers. And at the time it was a pretty big news story that this bill was trying to get through. And it finally did pass through the legislature. Governor LePage actually meant to veto it, but messed that up and didn't do it. And so it became law, which was great. But his administration did all they could to try to make it hard for that law to go into effect. So they dragged their feet on the writing of the rules. They originally crafted rules that didn't really get at the spirit of the law or even the letter of the law. So there had to be a lot of comments and changes by advocacy groups and individuals who were affected to try to push for them to have to change those rules. And then even once they finally made changes, it's still, and those changes were approved by the Attorney General's office, it still left people out who the law intended to be covered. And then when the Mills administration took over, they rewrote those rules, and they are better, and they are including more people now. But there's still problems with them. Like there's still ways that those rules exclude people who were meant to be covered and were meant to be able to access general assistance, which is really like the safety net program of last resort for people. And so like we're still 5 years later fighting to make changes to fix that program, to fix those changes that were passed in law back in 2015. So it can be a long process to try to make a law get implemented the right way.
Thanks, Kathy, for that. And I'm appreciating in particular that you brought up asylum seekers and the challenges that immigrants, refugees, and asylum seekers have had in accessing support in Maine, because what we know about survivors in those communities is that they face particular increased barriers because all of that, because their options are even fewer, right? Their options for accessing the things that might allow them to achieve safety and self-sufficiency and independence are even fewer. And they are frequently experiencing tactics from their abusive partners that include things like withholding their documentation that might allow them to access some of these helpful programs, or even allow them to verify that they're allowed to be here. And so that intersection there of domestic abuse and folks' immigration status and the options that they have for economic support, I think is a really important one to lift up. Thanks for that.
Yeah, and when you layer that on with language barriers for people who maybe don't speak English or read English, cultural differences, like coming from countries that don't have similar programs or don't understand how like those programs work. Like there's just so many layers that make things more complicated in already complicated systems.
Yeah, I think that people don't always think when they see a item in the newspaper that's about general assistance for asylum seekers, they might not be thinking about domestic abuse and violence and survivors, but they should be. They should be. Yeah. Desti, did you want to add anything on this piece?
I think Maya and Kathy covered it. The only thing I guess I would say is just sort of in sum that oftentimes I think people approach bills as though if you get it over the finish line, it's done. And for almost anything that has any level of complexity, that's just not true, sadly. Like the implementation, the whatever comes next, whether it's in the rules, like something really complex like GA, like Kathy speaks about, or even the implementation of something like the the X marker on a birth certificate, which I think Maya referred to, being able to, change your gender identity on a birth certificate. There's still a lot of work in terms of how that's implemented. Like, who's printing those forms? What kind of electronic system does it go into? How are people trained at the local level about talking to families or, individuals about, how to apply for this? And I think we see that, with survivors as well. The actual implementation of something like a protection order has just layers upon layers of complexity, from the state level all the way down to, your local city clerk or, records officer at the hospital. And that people should not be discouraged about that, because there are people in the community and activists and advocates for whom, like, we are here to try to make visible the invisible.
Thank you. One more round of questions for you all from me, and then we're going to move to questions from our audience. Kathy, when you think about how Maine could shape its economic policy in a way that would support the most vulnerable people, and I would argue that that includes survivors of domestic abuse, particularly those from marginalized communities, what do you see as the opportunities before us?
Yeah, that's a great question. I think one thing is just also to ask ourselves the question at the start of the policy process of, like, how would this policy, as we're thinking about crafting it, impact different communities? And think about its impact on communities of color, on different genders, on different ages, and on different lived experiences. Because I think so often it just isn't even thought of necessarily. A lot of policies get crafted with good intentions, but they don't realize that it's complicated to figure out, like, how to make sure everyone's actually included. And, like, one example, a recent example at the federal level was around the stimulus payments that many people received because of COVID. As I'm sure many of you are familiar with, like, for survivors in particular, there were challenges, especially if people filed taxes with their abuser, then they may not be able to access that or figure out how to access that stimulus payment for themselves. And there are groups like the Cash Coalition here in Maine and others like yours and Maine Equal Justice who can help people figure that out. But for most people, they don't even know what organizations to turn to, so they don't know how to figure that out. And so it would have been better if in the crafting of that policy, somebody had said, like, how could we make sure that survivors are thought of in this process? I also think there's a great opportunity when we think about equity around racial disparities, because there has been a lot of attention paid, particularly this year, to disparities here in Maine, because Maine did have, and I think still does, the worst COVID disparities for people of color, and particularly for Black and Latinx people in our communities. And so there's, I think, a lot of looking at, like, how can we create systems in the legislative process to think about the impact of policies on those communities. And in the past, Representative Talbot Ross has put in bills that would create, like, a process for a racial impact study for bills to help the committees figure out, like, oh, what is the impact on these communities? And there's now a permanent commission that's focused on communities of color in our state and tribal communities in our state that are trying to help legislators think about those questions and figure out, like, what processes can we put in place to start thinking about these things. And I think that's true for all of the communities that we're thinking about when we're trying to think about how can we help the people who are most vulnerable. But in terms of some specific policy opportunities, I think one is thinking about access to healthcare and continuing to try to close gaps in that access. So one big looming gap that has been a big topic of conversation because of COVID is that there are many immigrants in our state who don't have access to Maine care. Their economic level would make them eligible, but because of their immigration status, they're not. And that can be people who are here. They may have their green card already, but if they haven't had that green card for 5 years, depending on other aspects of their immigration status, they may not be able to access Medicaid because of a federal regulation. In the past, and that also includes some asylum seekers, and it includes people without documentation. Prior to 2011, Maine used to provide coverage for those individuals with state funds, but then we stopped doing that during the LePage administration. We haven't yet reinstated that coverage. So I think that's a huge opportunity. Obviously, like all of our public health is reliant on all of us being healthy. So we should be doing all we can for everyone in our communities to have access. And then also looking at opportunities to close gaps for other people who can't access healthcare because of other inequities in our systems, whether it's people who are transgender who can't find a provider with whom they feel safe, or the Indigenous African American community that often experiences racism in the medical systems, whether it's people with low incomes who have just like had a lot of negative experiences with the Department of Health and Human Services and don't want to apply for Medicaid if they're eligible. There's lots of ways that we make it hard for people. And then I think there's also definitely opportunities in terms of housing, trying to help make sure people can maintain the housing that they have, can find affordable housing if they need it, and that housing is safe for people in lots of different ways. Looking for opportunities around childcare access, like we talked about before, that's a huge, huge issue. And I think more and more people are understanding how that impacts our workforce and impacts our education systems here in Maine. And then also just looking at ways we can make sure people have the basic income they need to survive. More and more you hear people talking about things like universal basic income or other ways to make sure that people, no matter who they are, have at least enough to meet their basic needs, that they can get healthcare, that they can have shelter, that they can have food on the table. I think that's obviously not like our utopia vision of what everyone has, but that's like the basic minimum that everybody needs, and like looking for opportunities to make that happen. And I think there's a lot of political will to do that. And I think we just have to figure out how do we also build the political will to find the money to pay for those things.
Thank you for that, Kathy. Thank you so much. This next question is for Maya. Can you please describe how passing and implementing policies that support trans people generally makes a difference for trans survivors? And I think you've talked some about this, but I wonder if there's more you can say.
Oh, wow, I did answer that question earlier, didn't I? That's okay, because I will use this opportunity to continue to expand on other things as well. Like when it comes, because I talked a lot about like how to include youth and how to support youth, and there needs to be a way of doing that without fetishizing trans youth, because that tends to happen a lot with young trans girls and young trans feminine folks. So being able to handle policy implementation centering on trans youth with a level of care and with a level of intentionality and including their voices at the table, because if a bunch of adults are speaking on their behalf, the point is false. Like the point is not as intentional. So bearing that in mind, and I really appreciated what was said about including many different people at the table. The trans community is a very diverse community. I'm going to use the term intersectionality here, coined by Black scholar Kimberly Crenshaw. When it comes to sexual violence and domestic violence, trans people of color and trans disabled people tend to face them at higher rates, and they need to be included when it comes to talking about this. And when there's more hyper visibility within those policies, as well as in coverage about trans people, that begins to destigmatize those identities and begins to include them more. So I wanted to be sure to talk about that, and I'm gonna look at my notes to see if I have anything else. And also a reminder of how finances impact domestic violence situations, particularly for trans people, including around like, oh, you're using our finances to pay for your hormone therapy, how dare you? And that's an act of abuse, or withholding their methods of treatment is hurtful. So being able to set up a safety plan when it comes to having those backups, especially the most gender affirming things that you would even least expect, if it's not medically related, or if it's not, or if it's not their ID, being sure that when it comes to developing a safety plan, that they have their makeup, they have their prosthetics, they have other things that you would barely think about. And our Safe Haven committee that meets once a month on the first Tuesdays of every month from 6 p.m. to 8 p.m. We actually have the opportunity to review some policy reviews that people have sent to us. For example, the organization Every Voice sent us a policy they were working on for college students and education on sexual assault prevention. We also received a policy from Safe Nurses as far as how to be more trans inclusive and how to make their language more gender neutral and gender expansive. So, and more information about that is at the maintrans.net/survivors in the chat. And I'm glad that Dusty had mentioned changing gender markers and changing your name. I did include a link to that as well for more information about that.
Thank you, Maya. Dusty, last question before we take audience questions. And so feel free, folks, if you have questions for these people, to drop them right in the chat. You know, we're right in the middle of the busy political season, right? When many people are aware of politics in ways that only happens every 4 years. But the truth is that the work around crafting public policy happens year round all the time, and it will continue happening in ways that are probably less dramatic than what we might see playing out right now after, you know, we get through this election. And so how do you see opportunities for Maine people to engage in the issues that we've been talking about and the processes that we've been talking about today in an ongoing way moving forward?
Sure. You know, I think that's a good question because it also speaks to all of those other barriers about, you know, how do people feel that there's a place for them in, you know, policy change or in civic life, and then how do you actually go about making change when you see that change needs to happen? And I guess I would say that there are lots of different doors for getting engaged. And it depends on, you know, if you want to be sort of generally informed. And for general information, I would say that, you know, actually social media and email lists of advocacy organizations, like a lot of us are out here trying to make information available to the public. And so there are lots of really powerful advocacy organizations that have deep respect for across Maine on many different issues. But when it comes to wanting to really dig in and address something that you see in your community or in your life or with your family that you know needs a change, the two best, you know, the routes I would suggest for folks are first, really, I think often people tend to like call a legislator. If you're a person who, you know, you see that you want to do a thing and you think it deserves a law, make a call to a legislator. And you absolutely can and should. Their whole reason is to serve their constituents. They, though, may act on that in different ways. Not everybody subscribes to the same you know, process for how they engage with their constituents. So that's going to be different no matter who your legislator is. But you should absolutely let them know. And right after the election, when you find out who your newly electeds are in your community, you can absolutely send them an email or make a call. I think that feels awkward for some folks if you're not in the habit of making a call to a legislator. Actually, you know, they have lines at the State House. They have State House numbers. And so it's not it's not like you're going to their house and like leaving a note on their car windshield. I don't recommend that. But like, you can totally use those resources. They are there for you to be able to reach out to those folks and let them know about the issues that you care about. That said, they are regular folks like you and me. And so they don't know what they don't know. And there are a lot of complicated issues that legislators just are not going to have expertise in. And so best case scenario, they're going to bring it to an advocacy organization or to other legislators or policymakers who do have expertise in the issue. That way, everybody's on the same page about what the changes that, that we're all going to need to work on. The other thing, though, is just to reach out directly to organizations like any of ours here and, any number of other organizations that are doing public policy work. Because, as Kathy noted earlier, there are people on the staff of, statewide nonprofits whose job is to help kind of navigate systems and processes for folks. And I worked for many years in sexual assault public policy and spent a lot of hours on the phone with people trying to sort of parse through, is it actually a law, or was it a misinterpretation of a law that might already exist, or, was it some other thing? And so advocacy, organization folks are really receptive, I think, to having those conversations. And I encourage people to do that. They'll also be the ones most likely potentially to be able to know the best legislators who can reach out to, who you might reach out to in terms of figuring out, what policy. So, the folks at MCEDV, they know the legislators who have expertise in domestic abuse issues. Maine Coalition Against Sexual Assault, like they know about folks who have expertise in sexual assault. Maine Transnet, like you understand, you've got relationships there. And so that can be a really good pathway. And finally, I would say, not to discount the power of working at a really micro local level. Your town councilors or your city councilors, those are places where there's a lot of opportunity to make powerful change. Because, you may have relationships, the issues that they're working with might be a little more, easy to change. Not always, obviously, but, when you're working on a small scale, sometimes things aren't as complex and it's a little easier to move. I go to lots of city council meetings in my town of 10,000, and there aren't people who show up all the time, banging their drum. And so the squeaky wheel in this case really does have an opportunity to make change. And if they can't, then they should have a responsibility to help connect you with the folks who can, who know what the right sort of levers of power to pull are. I hope that answered your question.
It did, thank you. It made me also think about how often folks sometimes jump to the idea, we hear often from folks in the domestic violence policy realm, of people wanting to create a new law to fix that thing, when what we know is that A, there is no easy fix for domestic abuse and violence. It's incredibly complex and incredibly fraught to address, and that we have actually a really strong set of laws here in Maine. And so sometimes there may be a need for a new law, but there's often a need to have that same kind of consideration of, okay, is there an opportunity to implement this policy in a different way than it has been? Is there an education need? Is there, sort of a training need here? We're not going to create laws upon laws upon laws upon laws and get ourselves out of this problem. So now I wonder, Andrea, have folks put any questions in the chat for us?
We have no questions in the chat. However, a great offer from Maya that any any general questions folks think of after the presentation, please feel free to email those questions to info@mainetransnet.org. They have a small staff, but really are there to answer all of your questions about how things are impacting trans individuals in Maine.
Thanks. Are there questions that folks really wanted to just unmute and have the opportunity to ask? You could do so now, though just remember that you will be in the recording, so consider that.
Before people ask questions, I was just going to add one more thing. In the SANDV world, we talk a lot about hopeful mistrust, where there is an acknowledgement of mistrust with a set of providers or an organization or what have you. So there's the hope to reconcile that by creating safer environments and safer procedures and safer policies. Therefore, when it comes to policy making and advocacy, even if trans people do not trust you, you do the work anyway. And that is included with policy making, as you were talking, Regina, when it comes to like we're trying our best, and sometimes this avenue could work, sometimes it doesn't, and being as transparent as possible because of how hopeful mistrust exists.
Thanks for that, Maya. Any questions for this group? Well, hearing none, I want to just wrap up and share a couple of tidbits. First off, I really want to thank the Maine Women's Lobby for co-planning this event with us at MCEDV. We had kind of a vague idea that we wanted to do something like this, and Desti and her team really helped create this space and create this opportunity. So thank you for that. We really want to thank Maya and Kathy for giving your time at what we know is an incredibly busy time to have this conversation with us and to lift up your expertise. We're so grateful to you. If folks are interested in continuing these kinds of conversations, there's a couple of opportunities coming up. Andrea Mancuso is going to be on Pine Tree Legal Association. Did I get their acronym right, Andrea? Assistance. I always mess that up every time. Excuse me, my friends at Pine Tree, forgive me. But PTLA's Coffee and Conversation series, she's going to be the guest there next week on the 29th at 9 a.m. So you can find out about that on MCDV's Facebook or on Pine Tree's Facebook. There's a link to register there. There's also going to be an evening panel hosted by our member program in Penobscot and Piscataquis County Partners for Peace. And Maya will be on that panel, as well as our colleague Samat Abdurakib from the MCEDV team. And that panel is called Hear Our Voices to Diversity in the Anti-Violence Movement. Did I get that right, Maya?
I believe so. I don't see the email in front of me, so I trust you.
Excellent. Good. Oh, well, I have all the power. So just know that we're really interested in continuing these kinds of conversations and helping Mainers really understand these complex issues that both lie at the root of domestic abuse and violence and the complex paths to addressing it. So we're so grateful to you all for the work that I know some of you do. I recognize some of the names on this call, and thank you all for taking the time to be here today. And we'll be sharing out the recording so you can send it to all of your friends. So thanks, everyone. Bye-bye.
Thank you so much.